Hello, Lou and Chava. Thank you for that introduction. My name is Ryan Aycock, and I am a professor of emergency medicine at the University of Central Florida in Orlando. I am also a practicing emergency room physician. What I am not is a bartender or a biostatistician, but what I'm going to talk to you today about is how medical research happens. Now, I promise you, we'll talk about how booze relates to all of this, so don't stop the video just yet. All of medical research can be summarized in three basic questions. How good is my test? How good is my treatment? What's the worst that can happen? So if you think of a test like a COVID-19 nasal swab and it comes back positive, you may be wondering, what does that mean? And so for a medical researcher, they're going to throw out terms like likelihood ratio and predictive value and validity versus specificity versus sensitivity. None of that really applies to this lecture, and we really care about these next two questions: how good is my treatment and what's the worst that can happen? Or in the case of alcohol, is alcohol good for me? Or conversely, is alcohol bad for me? The way that we answer questions in medical science is by using the hierarchy of evidence. So you may remember back in ninth grade biology, you were told about the randomized control trial, and you were told that you need experimental groups and control groups, and you want to control for every variable except for what your variable of interest is. So for a drug manufacturer who's making a new chemotherapy agent, they may take thousands of lung cancer patients and give half of them the chemotherapy agent that's under investigation, and then give the other half a placebo and see what happens. Ideally, we would perform these randomized control trials on large groups of twins. Unfortunately, we don't have that as an availability. So instead, we focus on a large population of interest. So here's one such study that came out in the 1980s. These researchers took 1,200 men with severe coronary artery disease and randomized them to receive either aspirin or a placebo, and then watched what happened over the course of the next 3 months. They were surprised to discover that patients who received aspirin had a 50% decrease in the rates of heart attack and death. So they dropped the risk of dying and they dropped the risk of having a heart attack in half just by taking aspirin. Several more studies followed up throughout the 1980s and proved that aspirin was beneficial to people with coronary artery disease. Now, there's a lot of controversy about this study, mostly that it was conducted only in men, and it was only over a 12-week period, and it was only in men who had severe coronary artery disease. So keep that in mind when you hear a study that says aspirin's good for the heart. It's really only in this specific population that was demonstrated. So thinking about how does alcohol relate to randomized control trials? Well, this is a real study that came out of Australia a couple of years ago that was sponsored by Red Bull. What the authors of the study tried to determine is, if I drink vodka and Red Bull together, will I perform better on a cognitive test than if I drink vodka by itself? And the short answer is no. You will still perform poorly on a cognitive test if you are drunk off of vodka, regardless of whether or not you drink Red Bull. So this is an example of the randomized control trials that can be used to assess how good or how bad something is with regards to alcohol. The big problems with these randomized control trials is that they're really expensive. Everyone gets paid, all the data collectors, sometimes even the participants are getting paid. And it's time consuming. As you can imagine, following someone for months or even years in the case of a chemotherapy drug is going to eat up a lot of time. It's also logistically different. So if you imagine the COVID-19 vaccine was given to 30,000 people in its clinical trial, now I've got to find a way to coordinate all those sites and all those doctors' offices with getting that vaccine out to people or giving that placebo out to people. And finally, it's possibly unethical. I can't take one group of people and say, I need you to smoke for the next 20 years, and the next group of people and say, don't smoke anything for the next 20 years, and then watch to see the effects of tobacco. It's never going to fly here in the United States. So if I don't have a study that I can perform under ethical constraints or because of expense or time, then I can turn to the next line on the hierarchy of evidence, and that's the prospective observational cohort. What this means is I'm going to start today at time 0, and I'm going to take a group of people and just watch them. I'm not going to do anything to them. I'm not going to randomize them into any groups or perform experiments on them. I'm simply going to watch them. One of the most famous examples of this was the Framingham Heart Study. A group from Boston University and the National Institute of Health went to Framingham, Massachusetts back in 1948 and decided they were going to take 5,000 participants in this city and watch them and just see what happened to them. This study is still ongoing. So here we are almost 70 years later, and we're still following the effects of the original participants, their children, and now their grandchildren to see what happens when someone has high cholesterol or someone smokes or they have high blood pressure. And that's exactly what came out from this Framingham study. In the 1950s and later 1960s, we discovered that having high blood pressure, high cholesterol, and smoking cigarettes were all associated with heart disease. And here's how it relates. Here's another study that was pretty well done on how chocolate affects heart disease. So what these researchers did is they divided people into quintiles. So people who never experience the deliciousness of eating chocolate versus people who eat just a little, and then people who consume lots more as their day goes on. Whether you have dark chocolate, milk chocolate, whatever kind you get, if you eat more chocolate each week, your risk of cardiovascular disease goes down. And this is a pretty impressive cohort study that didn't necessarily prove anything, but it did demonstrate a nice association between why we should try to eat more chocolate every day. And I guess as promised, here we come to how alcohol plays into a cohort study. These researchers from Norway took pregnant women and asked them or went through their records to see if there was any history of alcoholism. And if a woman was diagnosed with alcoholism the same year that she gave birth, there was a 50% greater chance that her child would have birth defects. If the woman was diagnosed with alcoholism a year before giving birth, there was about a 17% chance. And as time goes on, if a woman was diagnosed with 2 or 3 years or even more, the risk of having birth defects went almost to zero. No reasoning was given for the lowered birth defects rate as time goes on, but I imagine it's because women who were alcoholics got help and stopped drinking and therefore did not have any birth defects because they didn't drink during pregnancy. All right, so that's a prospective study. So it's a lot less expensive. It's still time consuming because, as you can imagine, Framingham's been going on for 70 years. It's still logistically difficult if I've got to follow thousands of people and watch their dietary habits over the course of many years. And it comes with another problem of I can get led astray. So in the course of, say, eating chocolate, for example, maybe the people who eat more chocolate also exercise more and they don't smoke cigarettes. And so I may think that eating chocolate is beneficial for me when really it's something else like exercising or not smoking cigarettes. All right, so now I got to go down the hierarchy of evidence even more. So I don't have much money and I don't have a lot of time. So now I'm going to go down one more tier, and this is called a retrospective study. So instead of the prospective observational cohort, which says time 0 is now, and I'm going to watch everyone in the future, a retrospective study says, I'm going to just take whatever data I can get in the past and run with it. As you can imagine, it's a pretty easy study to do. And sometimes we do get some beneficial information from it. But you've got to be careful. When I talked about getting led astray, these retrospective studies often can lead to various answers. So let's take eggs, for example. You may have heard that eggs are good for you, or you may have heard that eggs are bad for you. And the reason for that is because of these retrospective studies. So here's an example. These researchers reviewed multiple egg studies that have been published over the last 20 years, and they found that the data was all over the place. Sometimes your risk of heart disease and stroke goes up. In another study, it may say that your risk of heart disease and stroke goes down. And if you're confused, so am I, because these retrospective studies have found various answers really all over the place. So at best, we can say we don't know entirely sure if eggs are good for you or bad for you, and we can't make a recommendation one way or the other. And this gets to the heart of the problem. So the gentleman that you see pictured there is Raymond Pearl. He was a professor of biology and statistics at Johns Hopkins University. He decided to go around Baltimore asking people what their alcohol consumption patterns were like. He asked them their age, and then he asked about deceased family members, and asked what their alcohol consumption patterns were like and at what age did they die. He then published this book called Alcohol and Longevity in 1926 that summarized his findings. Now, he had long tables of data that were pretty difficult to make it through, but if you were to graph his information, you might see something like this. So for 62-year-old males, what he discovered is that someone who drinks some had a lower death rate than a person who abstains from alcohol entirely. And then as you become higher and higher on the alcohol consumption curve, your risk of death goes up. What his conclusion was is that people who drink alcohol in moderate amounts die less often and live to go to a longer age. His findings were highly controversial. Number one, because his book was published during Prohibition. But number two, despite being a scientist, he made some pretty big mistakes. For example, he never once asked, why did the person die? So if a 62-year-old drowned in the river, that person would be put on this data plot somewhere for how much alcohol they were drinking, even though alcohol played no role in their death. So his book came out in 1926, like I said. Multiple other population studies started popping up going from the 1950s onward. This group, for example, was based out of England and noticed that the French were dying less often of heart disease than the British. And what these particular authors started thinking about was French people drink a lot more wine and eat a lot more fatty food, yet die less often from heart disease. And over the course of the 1960s and 70s, we started noticing that other groups, such as Spaniards, Portuguese, and Italians, were also dying less often from heart disease than other Europeans, but especially the French. The French had a death rate of heart disease almost 1/3 of that of the British. And so this is where the phrase the French paradox came from. It's where French people who eat lots of fatty foods and drink lots of wine still continue to live longer, especially with relation to heart disease. You may have heard the rumor that red wine is good for the heart, and a lot of that sprang out of these studies. Keep in mind that a lot of these particular studies did not look at what else was going on in French people's lives, such as did they walk more? Did they eat less processed food? And so other questions that could relate to why French people died less often from heart disease. Other researchers will then try to explain these findings by throwing out phrases such as antioxidant properties and flavonoids. And keep in mind that none of this has ever been tested in a randomized control trial. So we can't say for certain yes or no if drinking a glass of red wine each day is good for the heart. So what someone else tried to do then is take all these different studies encompassing over 1 million people and just plotting what was the rate of death versus how much alcohol was consumed. And what these particular authors found is that if you drink just 5 grams of alcohol a day, you'll cut your risk of dying down. And as you continue to drink more, you lose that mortality benefit. And then as you become a raging alcoholic, you're eventually going to die at a much higher risk. Well, here's the problem. This cutoff is at 5 grams. So you think about a 1 ounce pour of 80 proof vodka is about 9 grams of ethanol. That's over here. Do you know of any 1 ounce cocktails? I don't. Most cocktail recipes I see call for 2, 3, even 4 ounces. So you're hitting over here. Now you've lost your mortality benefit with that one cocktail. It's why the United States Department of Agriculture in its most recent dietary guidelines says that for people who do consume alcohol, they should have only 1 drink a day. And they put that 1 drink at 14 grams. So right over here. The USDA also says in its dietary guidelines that it cannot make a recommendation as to whether or not people should drink, because again, we're not entirely certain about this J point. No randomized controlled trials have ever been performed on people drinking alcohol to discover if this finding is real or if there's something else going on in people who drink a small amount of alcohol. For example, do they smoke less or do they exercise more? So finishing up, I'll just show you the hierarchy of evidence one more time. These 3 tiers, we really look for randomized controlled trials. And if we don't have that, we're going to look for a prospective observational cohort. And if we don't have that, we're then going to look for retrospective studies. So whenever you hear research shows or someone did a project that demonstrated, you've got to ask yourself, how was it performed? Were there experimental groups and control groups in a double-blinded fashion? Was this a large population that was followed over the course of many years? Or was this simply a survey of respondents to ask, how much do you drink or how much do you eat with regards to eggs or chocolate or anything else? There are other elements to the hierarchy of evidence that I don't show here, things like computer simulations and animal studies using lab rats. There are also statistical tests called meta-analyses, which combine data. But really, these are the big three things that involve original research of humans that you should look for whenever you hear a claim. Thank you again, Lou and Chava, and I hope everyone got some kind of benefit out of this.